Okay, so I guess I have to start afresh. Good morning, everyone. We were looking at the NHI and we were basing our study on the Golden Rule, which essentially says that we are to treat others as we would like them to treat us, to do unto others as we would have them do unto us. And then and because with the message of equality, we are beginning to relook at many things, how we treat other people, both externally and internally. And the study of the NHI is very much external, of course, but I wanted us to have an idea of the history of where this all came from and why it's such an important study for us to understand, because the NHI is really very much in the news lately. So much is happening currently about the NHI. So we did two studies about 2-3 weeks ago, and we saw that healthcare expenditure in South Africa is about 8% of the GDP. The GDP is the total amount of money or the cost of goods and services in the whole country, talking about everything: health, education, mining, business, everything. The total amount of money that is spent in goods and services, 8% of that is spent on health. And that amounts to 405 billion US dollars every year. That amount is divided, it's spent 50-50 between the public and the private sector. So it means that $402.5 billion are spent in the public sector to cater for 83% of the population. And then the other half, again, an equal amount of $205 billion is spent in the private sector to take care of 17% of the population. So it's like having two families that have the same income, but they have a different number of people to take care of. For example, family A may be earning 5,000 Rand and they have 10 children to take care of. And then compare that to family B with the same income of 5,000 Rand, but they only have one child to take care of. So you can really see that family A will really be struggling to meet the needs of their 10 children with that 5,000 Rand. And we can see that in family B, that one child is really going to be living the life because the parents can be able to afford the best for that one child that they have. So that's just a small nyana parable to help us understand the differences between the public and the private health sector. And that people that access the private sector get a far more better health care service than do people in the public sector. So then we went through a history of South Africa and its struggle to equalize a healthcare service delivery, and that this all started in the early 1900s. But we looked at the South African Constitution and the Bill of Rights, which indicate that everyone has a right to have access to healthcare services, including reproductive healthcare. It is in the Constitution, and also the ANC Freedom Charter, which promises to provide a preventative healthcare scheme that shall run by the state, providing free medical care and hospitalization provided to all, with special emphasis on mothers and young children. So the ANC, as well as the South African government, both have a commitment to provide universal health coverage. And so by definition, the NHI stands for National Health Insurance. And it's meant to be a centralized national insurance fund from which the government will buy healthcare services from healthcare providers in both public and private sectors. And all eligible South African residents, as defined in the NHI Act, will be able to visit these providers whenever they need healthcare without any payment. The NHI will make healthcare more affordable by reducing the cost of healthcare due to the economies of scale that can be achieved by purchasing healthcare for the entire population. So it works like car or home insurance. All the members of an insurance, let's say car insurance, they make monthly premiums. And when one is involved in an accident and they need to make a claim, then money is taken from that pool of funds to help that individual fix their car. So the same thing will apply to the NHI. It's a fund, and money is expected to be taken from the taxes, of course, and special contributions in line with what each person can afford. So the more a person earns, the more contribution they will make. And then whenever somebody gets sick, whether or not they make contributions to the fund, they'll be able to access the same healthcare services. So we know that there was a green paper published in 2011, which was the initial step that the government was taking to notify the public about their intention. And then a pilot project was commenced in 2012 to try out the experiment on the project and see if it works, how it will work, to pick up problems, to get feedback from the public, testing it out, really, test driving the whole system. So that pilot project began in 2012. In 2015, the white paper was published. So the difference between a white paper and a green paper is that a green paper is the first step towards making a law. So its purpose is to create debate on policy without actually committing to any specific action. So all stakeholders are invited to comment on the green paper. Then when that step is finalized, the white paper then is published, and it's a more authoritative report. It is seen as a statement of government, and it may also accommodate consultation with the public and stakeholders on policy, but it really signifies a government's clear intention to pass a specific law. So concerning the NHI, the white paper was published in 2015, sorry. And then we know that the NHI was signed into law May this year, 2024. So definitely the NHI is going to be implemented. It's now just a matter of time. And in fact, we are already in the initial stages. I also wanted us to recognize that 2024 is 100 years from 1924. And in 1924 is when this, politics in South Africa begins to address the issue of, is healthcare the responsibility of the government? Providing healthcare, is that the responsibility of the government, or is it the responsibility of the individual? So that debate begins in earnest in 1924, 100 years ago. And I wanted us to see that in 1924, South Africa had a coalition government, just like it has now. The other coalition government was in 1994, after apartheid was abolished. We come to 1994 and we have the first government of national unity that is 30 years ago, right? That was based on freedom. And so we do have all these interesting links that every time we are having a government of national unity, the issue of who provides for healthcare is agitated one way or the other. So we went through that history. We saw how in 1924, there was a coalition government between the Socialist English Party and the Nationalist Afrikaans Party. And then they established a welfare state system. And they actually came up with this policy of they began to debate whose responsibility is it to take care of people that are not able to take care of themselves, the disadvantaged people. So they came up with a policy in 1924. And then in 1926, they appointed a commission to discuss the issue of old age pensions. And then in 1928, they came up with the Old Age Pensions Act. But that act, which was intending to take care of people that have retired, received a lot of backlash from the conservatives, because they were arguing that the alleviation of poverty was not the responsibility of the state, you see. But in 1929, the National Party established the Carnegie Poor White Commission and argued that the alleviation of poverty was the responsibility of the state. In 1928, the commission argues that the alleviation of poverty is the responsibility of the state. I'm making a correction. But in 1929, the National Party then says, no, it's not the responsibility of the state to take care of poor people. But anyway, as the government was busy arguing whether or not it's the responsibility of the government to take care of poor people, then the 1928 depression happened. And we all know about the 1928-29 Great Depression that affected the West much, very aggressively. And we know that it changed a lot of things. So after that depression came and many people went into dire financial distress, now the government decided to actually act. So in the 30s, they came up with a social welfare framework. They were going to provide retirement pension for white people, whites and coloreds. The Blacks and Indians were excluded. But remember that the majority of workers were Black, and these Black workers were paying taxes. These taxes were the ones that were going to be used to provide pensions for whites and coloreds. The Blacks themselves and Indians were not going to be beneficiaries of this system that they were making contributions to. So that set the trend of the 30s. And it's in the 30s that then, after establishing the old age pension system, they began to discuss the issue of health. Is health the responsibility, the provision of health, is it the responsibility of the state or is it the responsibility of the individual? The argument began again. And we looked at many commissions that were set up to investigate these issues in the 30s and 40s. I'm trying to rush through the recap so that we get to where we ended last time. So a Gluckman in 1944, a Gluckman report recommends implementation of a centrally controlled NHS, National Health Service, focused on primary and preventative healthcare provided locally and racially segregated. So the Gluckman Commission does an investigation. They come up with a recommendation. They're like, let us set up a National Health Service more or less like the NHI. That will be focused on primary preventative healthcare. So I want us at this time to remember that there is a way in which a government can provide health services. two distinct methodologies. The one is to focus on primary and preventative healthcare, where a government will set up clinics all over the place. And the work of this, the emphasis is on preventative care. So much more focus on screening, running clinics with primary healthcare physicians and nurses. And the idea is to prevent disease in the communities, really run by public health principles, making sure that you have screening programs for diseases like TB, like HIV, like high blood pressure, diabetes, cancers. So you pour more money into preventing the disease. Then the other aspect of it, the other methodology is to focus on curative medicine, which you pour more money into hospitals, big hospitals, specialist healthcares, setting up theaters, and having a very robust pharmaceutical sector. This, you focus, you wait for people to get sick, and then you now try to fix the problem. And in last time we looked at this, we agreed that primary preventative healthcare is cheaper than curative healthcare, because these are the factors that are going to impact on whether the country is going to implement NHI or not. It's going to be all about the money. They're going to be discussing, okay, if we're going to provide a universal healthcare to everyone, are we going to afford it? But affordability is affected by which methodology you're using. If you're going to focus on primary healthcare, it will be more affordable, and it makes better sense, really. But if it's going to be curative, that is really, really an expensive system to run. Paying salaries for specialists. Hospitals, of course, are bigger and more, and they're like big white elephants that consume huge amounts of resources. So that's a very much more expensive system to run. So I also want us to see that distinction, that whenever a country looks into establishing a universal healthcare, it's more about primary preventative healthcare than curative. Because it's cheaper to run, and it makes better sense to prevent a disease than to wait for the disease to develop and then make money out of it. Because that's the ethos in private healthcare. It's all about making money. And if it's about making money, then it means that you need to not focus on preventing disease, because if people are not getting sick, you're not going to be making money. So that's the ideology behind the two systems. Right, so in 1944, the Gluckman report recommends that we set up a primary and preventative healthcare system. But in 1948, the National Party, which is in power, implements apartheid. Okay, and so most health centers are closed down, because now we have a completely divided government running a completely divided system. Blacks live on their own, whites on their own. And this is when the idea of a national health system is not adopted by the government that has been struggling with this idea since 1924. And so the National Party now is fully implementing apartheid in 1948, and they completely abandoned the idea of a national health system. So it is at this point that the ANC, which had already been in existence, takes over the mantle of universal health system reform. In the 60s and the 70s, the apartheid government, now, of course, after 1948, when apartheid is implemented, the private sector begins to grow. But as it's growing, it is only servicing white populations. And so the government can see that if they don't control the private sector, the white people are going to be compromised. They are going to suffer, because if a public sector is not controlled, it literally runs away and governs itself. And the public sector is profit driven. So when it comes to profit driven, if I am a GP and I can charge, let's say, 200 Rand for a consultation, and I get away with it, and there are no rules, no regulations to control me, I can decide next year I am going to charge 300 Rand. I'm the only GP around, so people are stuck with me. There's nothing they can do but come to me, so they will have to fork out that 300 Rand. And the following year, I increase my rate to 600 Rand. And I still get away with it because there's no one to check my actions. I can literally charge any amount that I want. So when the public sector began to grow in the 1940s, 50s, and 60s, because it's all profit driven, it's all about, I want to make money, right? The government then realizes that white people are going to be compromised. So the government steps in to regulate the private sector in terms of setting the prices, like you can't charge over a certain amount if this is the kind of service that you're providing. So the government steps in to regulate the private sector to protect white citizens. Remember that at this stage, Blacks are completely excluded. Blacks and Indians are excluded from this system. It's designed to benefit only white and colored populations. Blacks and Indians are still working. They are still the majority of working class. They are paying taxes, but these taxes are diverted to protecting only whites and coloreds. So by the 1960s, 80% of whites have private healthcare insurance, and Blacks have no cover, Indians have no cover, but they are the majority taxpayers. And the government is now stepping in to regulate the private sector so that the public is protected. I want us to see that now when we come to 1994, things are going to change when it comes to the regulation of the private healthcare sector. So you see the selfishness of the apartheid government in trying to, they step in to regulate things in the private sector when it's benefiting white populations. But now when we'll come to 94, we'll see what happens. So in 1974, de Villiers Commission argues that the regulation of the private care and better state services, they are arguing for stricter regulations. Then in the 70s, going into the 80s, neoliberalism began to grow. Neoliberalism is really just a new liberal approach to the economy. Because in the 80s, there was financial crisis, and so there was a lot of political pressure globally, all around the world, for governments to step down from controlling business too much, so that businesses can be allowed to just do what they want in order to grow the economies. So that idea of looking at things began to affect even how the private sector is being controlled by the government. So increasingly, and at the same time, the anti-apartheid movements had become more and more organized and militant in the 70s and 80s. We know that the ANC and all the other movements that were fighting against apartheid was growing and increasing pressure from even outside the country for apartheid to be abolished. So there was a lot of all these changes happening that led to the government facing a lot of pressure on how it was spending and how it was controlling the private sector. So there was a lot of deregulation that started to come in, and opening up of the private sector to now begin to accommodate Blacks and Indians. And then that led us to 1990 when Mandela was set free. So I think this is how far we came last time we met. So we're gonna pick up now from looking at the 70s and the 80s into the 90s and see how far we can go this morning. And then hopefully we will wrap up in the afternoon. At this point, I don't know if there are any questions or comments.
Hi, Dee.
Yes.
Uh, can you please share I really like your timeline, how you put the South African history. If it's possible, can you please share maybe after or before the presentation? I don't know. When you're done with it.
Yeah, okay.
Okay,
Okay, I
thank
will
you.
do
Thank
so.
you, sir.
No problem. Any other comments? Is my screen visible?
It's perfect, yes.
Thank you. Okay, so yeah, let's go to the 70s and 80s. I'm going to just read some paragraphs from this history. I think I will also share this document. I think it's very interesting for those who are interested in this subject to read through it. So despite being tightly regulated, the private health sector continued to grow, and subsequent decades would cement the position of for-profit healthcare as a major factor in future health system reform efforts. It is also the case that in this period, in the 70s and 80s, the health system served as a tool of surveillance and enforcement of apartheid policies. So many South African health professionals were complicit in the systematic denial of the rights to health for Black South Africans, and either actively supported or passively allowed these human rights abuses, including state-sanctioned violence and torture. So it was not just the government that tortured and oppressed Blacks in South Africa. It was also the health system. For example, there's a stark example that we can talk about of Steve Biko. We all remember Steve Biko, who was a very prominent, powerful activist, and he was, by and large, a non-violent individual, a member of the ANC, if I'm not mistaken. He formed, he was a student, a medical student at the University of KwaZulu-Natal, something like that, in the 60s and 70s. And he joined a student union, a student movement in the university that was fighting against apartheid. But interestingly, that student body was was led by white individuals mostly. But they interestingly exercised apartheid within that movement. He first joined that movement because from his desire to fight against the system of apartheid. But the movement itself was very racist. And so he left that movement and he created another organization, the South Africa SASO Student Organization Against Apartheid. And that's how he grew and became a very powerful activist. What happened to Steve Biko is that he, as an activist, he experienced a lot of detentions. He went through a lot of detentions multiple times. He would be detained and then released and detained and released. And we all know how he died, how he ended up traveling from Eastern Cape to somewhere in Port Elizabeth or something like that. And then how he was detained, arrested, just like that. And then he was detained, and then he was tortured and abused, and he suffered a head injury. And so he became unconscious. But Steve Biko was famous. He was known all over the country and all over the world. And so when he became unconscious during that detention, then the authorities became afraid that if he died there, they would be in trouble. So he was loaded onto a van, some kind of a van, Land Rover, naked, and transported from Port Elizabeth to Pretoria, unconscious and naked at the back of a Land Rover, a distance of over 1,000 kilometers, being handcuffed. And when he arrived in Pretoria, the doctors were requested to, basically they wanted him to be treated quickly to cover up the whole torture thing, because they knew if he died and the international world learned about this, it would really have a very, very negative impact on the apartheid government. So they needed the doctors to quickly treat him and cover up the whole story. So literally the doctors who consulted with Biko at that time in Pretoria, they claimed that he was malingering. The word malingering, does anyone know what it means? What it really stands for? What does malingering mean? Let's help each other. You can Google it. Actually, I'm just needing some feedback because I feel like I'm talking to myself.
Is it to fabricate symptoms of illness or injury, according to Google?
Precisely. Yes,
Yeah.
that's absolutely true. Thank you, Tato. It is to pretend to be sick when you're not sick, just to get some kind of attention, to escape from some kind of retribution. Maybe you don't want to go to work and then you pretend to be sick, or you don't want to go to court, maybe meet a certain obligation, so you pretend to be sick. So they assessed Biko, and they said, the doctors that assessed him said that he was malingering. Unfortunately, 5 days later, he died. Really, I don't know if anyone can imagine the torture of being naked, having been tortured and beaten, and then transported and made to travel a distance of 1,000 kilometers at the back of a vehicle and be expected to survive that. Well, he died 5 days after that. And then the doctors who consulted Biko in the 5 days before his death who had said that he was malingering or shamming, despite the clear evidence that he had suffered a brain injury. They failed to recommend their improvements in his condition or medical intervention. So essentially, because they diagnosed him with malingering, actually he was not treated. And they say, you know, the way he was tortured, he was beaten up, so his body was full of wounds. And when the body is tortured like that, it was swollen, it was full of wounds. When the body actually is beaten up in multiple places on the body like that, a lot of the proteins of the tissues are released into the blood circulation. And then they have to go to the kidneys because all the blood goes through the kidneys continuously to be filtered. So because there's so much of that stuff clogged in the kidneys, it shuts down the kidneys. So he literally had a brain injury, then he had myoglobinuria, they call it, and then he died of kidney failure. And yet the doctors diagnosed him with malingering. So if they at that point had treated, he made a correct diagnosis of head injury and kidney failure, they might have been able to intervene and save his life by giving specific treatments for the kidneys, fluids, and other things. So this is how the health system assisted in the system of apartheid. It was a really, really horrible system, and addressing that system and getting rid of it, destroying it, was much of the work that the ANC was going to do from the 60s onwards in their fight for freedom. It was also to address this system. So in the late 70s and 80s, I was talking about the neoliberalism, the financial crisis, and the political pressure from external forced deregulation of the private healthcare and a reconsideration of introducing a universal healthcare system that would now also try to include Black people. So we have the Brown Commission on Inquiry into Health Services, which clearly influenced by a commitment to privatization, considered that there was no evidence that the private sector was more efficient and that privatization had no benefits to users, but nonetheless supported deregulation of medical schemes, including the acceptance of risk rating, threshold payments and co-payments and deductibles. Okay, so then we go to 1990 to 1993. Okay, so this is when apartheid comes to an end. Nelson Mandela is released from prison. Let us look at actually what happened. The ANC is growing. It is preparing itself to lead the new liberated country. The battles that it's going to face concerning the issue of universal healthcare are very interesting. So we see that there's going to be an interaction between the ANC COSATU and the South African Communist Party. So within the party, the discussion is sparked the debate between. So there were two voices within the ANC. You had moderate economic thinkers. Moderate economic thinkers are keen to grow the economy. They want external investors to come in and pump money into South Africa. They want to present South Africa as a business-friendly space. But then on the other side, you had the socialist rhetoric, because ANC, from its inception, was a kind of a socialist organization in its endeavor to fight against apartheid, which was a divisive government. ANC in opposition was standing for unity, for no discrimination, for the abolishment of apartheid. So by default, ANC would be a socialist organization that would be fighting to bring South Africans together and then provide services for all South Africans. And remember that since 1948, since the inception of apartheid, Black people have been marginalized. They contribute taxes, but they are not beneficiaries to the system. So they are disadvantaged, they're economically deprived, educationally, healthcare-wise, in all aspects of life, they are disadvantaged. So the ANC, if it's going to fight against apartheid, it by nature has to fight for equality. It has to fight for the empowerment of a disadvantaged section of the population. But however, as it's growing through the 60s, 70s, and 80s, there are voices within the ANC itself that start to become selfish. They're starting to think about economic development. They're thinking about, let us fight inequality by making money. And on the other side, there is the socialist rhetoric, which is saying, no, if we are going to focus on making money, we're going to end up betraying the whole idea of equality. So there are two voices within the ANC. I don't know if I have articulated this well for everyone to understand. From the early 1990s, there are two voices within the ANC. I hope this is clear. So, two dichotomous economic and political positions are emerging within the ANC. You have the liberal argument, more like Republican kind of ideology in the ANC, which is going to support privatization, free market principles that are going to, they believe, will spur economic growth, and that if there is money in the country, this is what is going to redress the inequalities. And that apartheid was a drag on the economy, and that Black people are going to thrive if the economy is powerful. Then the radical argument was that apartheid and capitalism together are the ones that disadvantaged Black people and put them where they were. I want us to see really that if I am going to be super rich, there is no such a thing as being super rich as an individual above all else without exploiting people. We know that people that run big businesses, for example, Pick and Pay, for example. Well, let me use it as an example. Pick and Pay as an example. We know it's owned by one family in South Africa. They are super rich. But the only way they can be in the position that they are in is by exploiting the masses. If all Pick and Pay employees were paid good salaries, then that family wouldn't stand out and be as rich as it is. There cannot be such huge disparities between the rich and the poor unless the rich were exploiting the poor. Apartheid worked because the majority of the workers were Black and they were underpaid, and yet they were contributing to the taxes. And those taxes were being used to build a life for the white populations and give them a comfortable life. So apartheid can only exist because of the exploitation of a portion of the population. And such an economy, they say that actually by the time we got to the 90s, the apartheid government was failing economically. So people blame ANC and say, ANC has not done a good job, the economy is not okay, but actually they inherited the failing economy in the first place, because there's no way you can have a government that favors a certain portion and exploits the other portion and expect it to be a successful government. Apartheid was already failing, even by the time you get to the 70s and 80s. Because this system of capitalism is a system that allows business to do what they want in order to grow. The focus is on making money. And that system of capitalism, together with apartheid, is what and worked together to compromise and disadvantage Black populations. So then you had this dichotomy within the ANC. The one side saying, no, we don't want to go capitalist because capitalist is what put Blacks in the place they are. Then you had the other voices saying, no, if we have a free market, if we allow privatization, if we focus on money making, this is what is going to allow Black people to thrive. Okay, so that debate is going on within the ANC. Then, so what happened then in 1994? In 1994, when the first government of national unity after the abolition of apartheid comes into power, we're going to see that the liberal, neoliberal mindset wins over over the socialist mindset. Because then what happened is that the external world came in, and the World Bank began to recruit ANC officials to work in Washington in the early 90s. You have select ANC leaders going to work under Goldman Sachs in New York. You had other ANC officials being recruited to work with the World Bank in Washington. And in addition, the Consultative Business Forum, which was established in 1988 as a progressive forum to allow business to contribute to the promotion of a fair and just society, facilitated key meetings between the National Party and the ANC. And the relationship between the ANC and South African business really became more solid, so that in the HSR debate, now in the area of health, there was a corresponding acceptance of the role of the private sector. So as the government in 1990 to 94 is leaning towards big business, and you have ANC officials being recruited overseas to go and work in these big banks and big organizations, so that they can learn capitalism and learn how it works and come and implement it in South Africa. And the drive is towards boosting the private sector so that the economy can be recovered and grown. The same argument is taking place, the same corresponding emphasis is now in the health sector. So you will see that the debate between allowing the private sector to grow versus allowing the development of the national health insurance that will cover everyone equally is also now developing. Yes, Tato?
Hi, Doreen. Can I ask something? So it seems like ANC, both it being divided in such a way that the other ones, they want privatizations, and then the other ones, they want obvious social government. Because I see like a threat. How can I put it? Like I see it as ANC it seems like it has always been, I don't know if it's good or if it's bad, and that's the question that I'm asking. Because the way I look at it, it seems like ANC has always been a government which compromise just
Mm,
so that we have some sort of peace among the inequalities that we face, you know. So it doesn't, even though it has radical people, it seems like they compromise. Even though it has liberal people, they like there's so if you can understand what I'm saying, so there's that
mm.
thing of a compromise. So the question is ANC as a compromising government a good thing for the nation, or is it a bad thing? I'm sorry.
Mm,
I'm sorry for asking this because I know we shouldn't be looking as bad and good, but can I
mm.
at least have your understanding uh, of that?
Oh, thanks for
Hello?
that question, Tato. It's exactly the question that I myself had, and I don't have an answer. In fact, it was what I was going to ask this platform. And I'll put your question in another way, just adding a dimension to it. What is the best way to address inequality? Is it by making more money? So let's look at the two families, family A and B. Maybe it will help us. Family A has 10 children, income of 5,000. Family B has one child, same income, 5,000. What's the best way of approaching this inequality? Is it by making more money, or is it by sharing what already is there? Because this is the struggle that the ANC has been going through. Yes, ANC is a government of compromise, but it has always been compromising on the side of the private sector. It compromised in 1994 by allowing the liberal voices to override the socialist voices. Remember, as a movement, we are social democrats. We are not necessarily capitalist democrats. We are social democrats. We believe in equality. So what's the easiest? If you are faced with this situation, what would you do? There's a hand up. Is it Milton?
Hello?
Yes.
Okay. So the way I see this, when I'm looking at the two voices which are emerging, I'm trying to find a better word. Can we say those who are standing up for making money, are they really making a decision out of conscience, or there was also a form of bullying and even infiltration?
Mm.
So when you look at those minds, especially as blacks, some of them were actually maybe somewhere, somehow led into become the face of the argument. Because if that argument could be made by a white man, it would be easy to visibly see who is behind this agenda. So it can be easy that people who are coming out of poverty want to become famous, and some of them had to become those. I think those are the real traitors. When ANC fights about traitors, they don't actually address who was the traitor and in what sense or form. And they end up throwing that argument to just people whom they hate based on their differences. But I think people who sold the country are those who took an argument which they know will put their group they represent in a larger or difficult position than those who did it in a way that people think it was, selling out. The reason why I'm saying this, it's a trend that you see in almost all African liberation movements. They failed on the same agenda. When the liberation was coming to an end, there was a step ahead of the colonizers in terms of decolonization, which they started, let's say, let's discuss this, let's end this, as if they were ready to do it before. And they will come up with economic proposals to say, this is how we are going to. They've done it with Zimbabwe. UK was so much involved in the United States, sending proposals how the economy is going to reform. And very soon, when the government resists parts of those, or their, the economy will shake and they will start talking about inflation and all that. So, in other words, for me, the solution was not supposed. I think that when they say apartheid was failing, it had not failed if it was not completely collapsed. If blacks wanted to succeed, I think we're not supposed to fear the thing that the current situation is going to be worse. It was worse for blacks already. And they said we can preserve the little that is there and start building. What was the little that was there is the privileges that were going to be maintained. And we were put into building the economy, but for who? We had no answers on that. And the bigger picture was they play an imagery of things are going to be good for the country. They put the money on the good rate with US dollar and all that. But that is not the solution. It does not even address. You are just quiet or softened to keep quiet, but you end up forgetting your own problems. And they know that the society itself was going to buy into this over a long time. They will be divided on what should have been done. So I don't think the social agenda was radical enough. We've seen even with the United States, slavery and capitalism has always been good friends. When now even the Democrats and Republicans are fighting over social justice, they still compromise because they maintain capitalism and they still want those rich few to run the show. So I think the radical agenda all over the world has always that problem, and no one has ever came up with a social stand that succeed. It has always been trumped with capitalism. So I can say capitalism has been thriving, and everywhere it is practiced, equality is still struggling to gain the ground.
Yeah, thank you very much for that comment. Tato?
Yes, thank you, Elder T. So actually, it reminds me of the statement that Elder Pamanda did in one of his recent study, but not most recently. The ones he did, I think, around June. Just that I'm not sure. But he mentioned something about radical feminism and liberal feminism. Then he asked the question, which one have played the big role when it comes to women's rights, and you find that, according, to be honest, all these things, they are shaped by where society is. Remember that society, in the context of the economy, majority of the world's wealth is obviously among the white people. So I think ANC, maybe this it's something that I will say that, like, I think ANC reason maybe they can justify their compromises, that maybe they looked at how the economy is, and if they were radical about what they want, maybe a similar thing would have happened, like just what happened in Zimbabwe, where, everything has to come back, the land, the everything, money, all these things, they belong to the government and things like that. Then what you find happening is that the white economy, they move because they are the driving force, and they cannot reach a compromise with a radical government. They start to flee. And when they flee, you find now a depression happening in that nation. Because remember, like I would say that even during that time, black people were at disadvantage. They depended mostly on the white economy, So like I think there are these challenges around the world because of the world seems like it's not ready for radical shifts, So hence that's why we see even these radical movements, they really don't succeed in our time. The only ones that are succeeding, it's the radical rights. If I'm putting it in a proper way, around the world, what we see, it's the radical rights, which are like, because they really stamp, and even the society, the patriarchal society, the capitalist society, it supports them. So it's easy for them to implement their ideology around the world. And this is when we get more and more inequalities among people, even though we might not see racism the way it happened during the apartheid. But if you look at it in today's context, and based on your study, the NHI, public hospitals, it's full of Black people, and they are overcrowded. As you said, you mentioned they are understaffed and things like that. So it might not be the same racism during the apartheid, but if you can look at it, it's actually the same thing, because Black people are still suffering. They still finding, especially even the ones on the rural side, it's even worse there. So yeah, this is my observation of what I'm seeing happening, especially when it comes to the question that I've asked. But I wanted to also hear your thoughts. What do you think about it? So I don't know if the compromise is good or is it bad, but yes.
Well, the compromise, how can it be good? Because we know that the Democratic Party in the US is failing because of compromises. And we see, when you compare and contrast the Republican Party and the Democrat Party, you see that the Democratic Party is failing because they are not organized. They don't plan ahead. They don't have their vision clearly defined. They seem to be reactionary in their strategy, whereas the Republicans are prevailing because they take time to plan their things. They take time to organize themselves. They put their strategies in place, and they pursue their goals, deliberately. So compromise is the problem on the Democratic side. But what I like that you've said is that that the world is not ready for equality. That is essentially what it means. And even the history of the ANC, as we are looking at it now, we're not really looking at the history of the ANC. We're looking at the issue of providing a universal healthcare system that covers everyone equally, whether they are privileged or not privileged. That is the idea, based on the idea that you do unto others what you want them to do unto you, is the message of equality. And yet we are sitting now in a country where 205 billion rand is being spent for just 17% of the population. The same amount is being spent for 83% of the population. I traveled to Mossel Bay last week, and I was so shocked by what I saw there. I saw a town that is so neat and beautiful, you would think you're in Europe, where white people are 34% of that population, blacks are 17%, the majority are colored. I was shocked by everything that I saw, even going to the police station. No queues, no drama. The only black people I saw were security guards at the police station and at the hospital, but the majority of the people I saw are whites. just to see it, and I'm not saying there's something wrong with that, but I just want to show how we are 30 years into since 1994, and we are in South Africa, and there are towns in South Africa that are still so segregated. There's so much discrimination. And the hospital that I went to, it was clean. You hardly saw anyone around. There was no crowds. And I compared it to the hospital where I'm working right now, where, people start queuing at 5 a.m., 4 a.m. The crowds are huge. So even within the public sector, you have so much disparities. So 30 years on, after the ANC compromised in 1994 concerning health, because the debate was between two schools of thought. The first was saying, let us close the gap. Let us work on the inequalities between the public and private sector, arguing that let's have a single NHI system, which will provide equal services for everyone. And then the second one was influenced by the neoliberal principles and concerned that if we equalize the grounds, then the private sector is going to suffer. And they were suggesting that we leave the private sector to continue the way that it is for those who can afford it. And then just concentrate on improving the public sector for the poor people. And literally, we've been in 30 years in a system where the private sector has been deregulated. It's doing whatever it wants to make money, and it is taking care of 17% of the population, both Black and white. But I mean, when we talk about those are the people that have money, that can afford. And then you have the public sector, which is now taking care of the majority of the people who can't afford. And we can see that the two systems cannot even meet each other halfway. The public sector is overwhelmed, inundated with shortages in drugs, in manpower, and the services are so delayed. Some people never ever get the services that they need. I work in such a system. I know patients sometimes who are waiting, who die because they are waiting for CT scans to be done or ultrasounds, taking months and months of delay. And when you finally get a date for them, you call the family, the person died. And yet in the public sector, you can get service just like that. And to exist in such a society, you really wonder, is one life more important than the other life? So the ANC's compromise is really a terrible thing. And so when you look at the two-family example, how should we balance that equation? Should the first family A make more money, or should family B share what they have? And this has always been the argument, even in the Reconstruction age in the US after the abolition of slavery. The unwillingness of those who have to share with those who do not have. The idea that what I have is what's enough for me, and I'm not going to share it with anyone. Anyway, there's too many of them to share it with. Let them make their own money. This whole argument about the NHI, and even though the NHI has been now passed into law, there is still huge debates about it. People are still fighting against it because they're saying it's really to say the provision of healthcare is not the responsibility of the government. The person that is sick, it's their responsibility to take care of them, to see how they will get well if they don't have money, if they are a problem. And a poor person is poor because of their own mentality, blaming the victim. So it's something that we've already looked at. Milton was talking about how capitalism and racism had to work hand in hand to build the United States. And in that, I see that sexism, patriarchy has benefited so much from sexism. Because without women working in the homes, without being remunerated, we're not going to be here talking about this subject. men have benefited so much from the sexism. The patriarchy as a system cannot exist unless women are oppressed. So one cannot grow and develop and accomplish their dreams without exploiting another. And that's what we are seeing in this whole story. I saw Erica's hand up, and then it will be Tato.
Hi, Elder Doreen. Julia, it will sound strange, but I think you make much more light of the issue that's happening in South Africa, the segregation that's going on. It's much, much more worse. We experience, we can't have friends, white people friends. It's not possible for us because we can't find really people that are willing to put aside their racism. In Fall Park, Sasolburg, Van der Bijl area, I'm telling you, it's the worst. And white women is the loudest racist you will find. Their hearts had not been changed. I would say their hearts had hardened over the years, over the last 30 years. And they look at South Africa and say, yeah, but look, it's the black people that make South Africa. So you talk about the clean places that you saw. Yeah, that's what they say. Look, where we are, it's clean and nice. Where they are, it's not clean and nice. But what they don't see is the poverty and how hard that area has to work to help poor people, that they don't have the money, the resources that the others do. We are still sitting with the after effects of apartheid, slavery. For me, it's slavery, the same thing. And I'm telling you, it's not going to be solved on this earth. There's no way it's going to be, equality will be there in another 50 years because the people's hearts are so hardened. What should have happened in South Africa, I believe, is the moment freedom was granted to all, equality was granted to all the white people should have said, okay, can we help to teach the people that didn't have the chance to learn? Can we show them and teach them? Don't only give them the land that the state had. Sorry, my words is a little bit confusing. That the state had bought from them, from the white people, but let the white people be willing to teach them. Listen, this is this land, this is the areas, this is how you work. What would you like to do? Oh, the same as we do. Okay, come, let us teach you. A lot of the problems come in because the people could not run the businesses, could not run the farms correctly because of apartheid. They never had the chance to learn. That's why apartheid will not be solved. We're sitting still with people's heart that is so hard against another human being. Sorry, I'm very passionate about this. Thank you, Doreen.
Thank you, Erica. Tato?
Oh, yeah, I think really Erica took the words out of my mouth. You know, the question I have is that, and it's, I don't know how to put it, but it's that what happens if the one in power says, they threaten to leave, like, and this is what we see on an international level, because it's easy for as I was speaking about the white economy, if like they don't agree with what the if they don't agree with going to equality, and not just in a social level, but also in other levels of economy as well. They threaten like to leave, to go somewhere else. And I think this is where now maybe the international government maybe should also come in. So we even see the failure of the international government to really taking action against such people who threaten to leave the country, especially when they're going into a reformation of what apartheid has done to the government as well. Because it's easy for them to say that we'll take our money and everything that we own and go back to the West and continue our life as it's usual. And then obviously what we have witnessed is that when this happens, the country in which that happens, that like it becomes on an economic decrease, and it's really sad. Erica actually took the words out of my mouth by saying that this is not to bring a discouragement or things like that, but it's really sad. I don't want to lie. It's really sad that this is what is happening. This is what is happening. We can see it, and it's painful, to be honest, that as much as we'll never, I always say this, and I think even the book, the book that we were reading yesterday, Bell Hooks, I think she even says it as well. There will never be equality if the other party does not help when bringing that equality. This is both men, this is both white people. There will never be that equality if the other party doesn't come to play with solving those issues. There'll always be that if, it's the same. If men, they become, they become as if like they're victimized every time we speak about feminism, about equality among, it means that there will never be equality. When we speak about equality, they choose to separate themselves. They choose to go out of the conversation. And who is in power by that time? It's obviously the man. So, it's really is the sad truth that even if it can be 50 years, can be 100 years, as long as we're still in this world, as long as Jesus doesn't intervene, things are just going to be worse and worse and worse. We can even see it with the Sunday law, which is coming, or which we are already in, that things won't as long as we hear, Eden won't be like restored, the equality won't be restored. But obviously not to like bring discouragement. We know our roles as why this movement was raised. We know our roles, why we need to talk about these issues. We know the roles that we need to play in our daily lives. As much as we are observers of the world, but we are also participants in our own world, in our own homes, in our own communities, and we can speak up, we can help, benevolence, things like that. It's where we can cast our votes as people. It's the small things that counts, So let's not be discouraged. Yes, it saddens every day. You look into the news, you look into social media, you see all these inequalities, but we can still play a role in our own lives. Thank you so much. Thank you so much for this.
Thanks, Tato and Erica. I think bottom line, what we need to see is that that's why I want us to understand the NHI. I know that it's not really related with the test that we are facing, but so many people have been trying to understand the politics in South Africa. And the NHI has been under discussion for a long time. And I thought to myself, maybe let's present this subject so that we can be on the right side of the NHI situation. But in doing that research is when I came across all this political history that was connected with it, that it's an argument that's been going on since 1924 in this country. And you can see the selfishness of the liberal interests always coming through, the neoliberal capitalist mindset always blocking the development of the NHI. Even now as we are speaking, just this week, in fact, yesterday, I attended a workshop, not a workshop, a webinar, where someone was presenting on this NHI now, how we are going to move forward. He was just trying to explain how the government is going to start implementing NHI, but you could see the negativity coming from the people that attended the conference. How it's going to affect us and our money making and all of this. It's all about selfishness. And what I want us to see is that if the NHI is not established, let's say you have a cataract. A cataract is a very simple operation for all elderly people who develop cataracts to go and have it extracted. In government right now, if you go to St. John's in Joburg, which is a big cataract hospital, you might get your operation within a year. But in my province, in Limpopo, we have patients that are on a waiting list that is longer than 2 years, 2 to 3 years. They are sitting at home waiting for these cataract operations, which are done by volunteers who come once a year for just one weekend. And they're only able to do, maybe they'll only be able to do 30 cases. And the waiting list has hundreds and hundreds of people. But if you can go to private, you can get your op done the very next week for a price, 30, 40,000 rand to remove a cataract, just one eye. And we can either say, this is okay, this is a system that's fantastic, or we can say, no, this cannot be right. Because one eye cannot be of better value than the other eye. And the thing that differentiates one eye from the next eye is the pocket, and the world is saying poor people, the worldly mindset is saying poor people are in the condition they are in because of their own mindset. There's something wrong with them. The mindset that God wants us to have is that I am my brother's keeper. Those who are successful are successful. God blesses them. I don't even know if we can call it that, but they have means because they need to use those means to take care of those who do not have. Milton?
Okay. I just wanted to add on what Erica said. It's said that when you look at the great controversy from where it began and where we are now, we know things have become so complex that it's said that right now, when you look at the history of the 19th century coming forward, it looks like a black versus white issue. But I think the real elephant in the room, it's what patriarchy has done. You compare and contrast before the 19th century when the empires were there, even Africa had kings and rulers who was in control of that economy. It has never been the majority. It was the king. Everything that the society discovered, it belongs to the king. And when the modernization was happening, even before colonialism happened, those kings are the first ones to become prominent, and it is men. So whether you are in the pre-colonial era or after, what has embraced this division and this dominance, I think the root, it's actually patriarch. It is the one that has exacerbated the condition of this separation. Already women, before pre-colonial times, they were already victims of this system, vicious system of killings, rape, not recognized. In other words, actually, when you look at after colonialism, when I think there's a statement that Elder Pamina made before, like he uses the Dark Ages as an example, that we were living in the period of demons. I think we were in the West darkness even before we were colonized. When you look at effects of patriarchy, and when integration happened, it had its bad side. It brought capitalism, this economy of money and other things. But there's also benefits of how integration is managed, enabled us to actually see and start addressing things which were not even an issue before. So I think, as Tato is saying, not to be discouraged. What God wants us to see at the end is not to bring a solution of being comfortable in this world and deal with problems, but now to actually see the problem. And at least we are going to know what God is redeeming us from. And it's the effects of patriarchy. That's the root. It would be naive to think of a world where all solutions are actually put in place, because there are very few countries in the world who have managed to distribute their resources for everyone. Very few. The big economies, which are examples, are failing. And it's very sad that we have to be uncomfortable, especially when you look at the issue of race. If we are to bring feminism will show us that both black and white, we are victims of this system, and that can bring us together if we understand what is it that we are dealing with. So yeah, it's a sad situation to realize, but I think what can bring peace in our minds is to understand what God wants us to see, and those who are willing, because it's a mind issue. It's not about even the resources themselves, because if all those people who have resources understand the golden rule, they don't need to be told where to put their resources or to hoard for yourself. So yeah, I think the reality is to mature and understand what is it that we are being taken away from, and we can have peace and actually understand that God wants to heal the mind. And if everyone has that mind change, all these other things can be just solved by a different approach.
Thank you for all your comments and additions and adding dimensions to this discussion.
Hello.
And yes.
Hello.
Someone want? Yeah, go ahead.
I don't and I mean I'm talking about equality of the world. All these are coming out because of inequality. We are not the same. The world is not the same. Like here, when you explain, I mean, you are teaching us health care services. Here in South Africa, it depends. Other health services are, I mean, they are not on the same level. It depends on others on provincial level, others on national level. So you can see inequality other where the provinces are income, I mean the poor incomes and what they have poor qualities of services, and where others where the laborers and I mean the income is high is where the health services are good. And it is not equality, because if it was equality is practiced in South Africa, we could have national all health services could have been run on national level, but they are not run on national level. They are run on provincial level, and where the provinces are not able to do that, they have a lot of challenges. Even in America, it is the same way. Inequalities all over the world. I could not believe that in America, I mean, someone was telling me that my relative that if you want to leave Canada because they are being workers pays a lot of money in order the government to have services for everybody. You see, they tax them, maybe their services are also national level, where they make shelters for refugees, where they make all these things. But you, even all the world, their economy and social life, all these are inequality. We are only knowing this in this movement, that it could have been better if it was all run by on national level, so that all hospitals, all nursing, all health cares are run by the government of national or at national level. But that is maybe, I think it is inequality which is practiced, which is all over the world, which is in our movement. We have to understand it is not only here, it is all over the world. That is my little contribution. Maybe I don't know whether it's right or
Thank you. No, it's correct. It's correct. It's a global phenomena, and you know, we can see the distinction between purely capitalist health systems and the converse in many different settings. In the US, like I said last time, it's purely profit driven, and it's the most expensive health system in the world. And then you have countries like Canada and the UK and Germany who provide healthcare for every citizen. Yeah, but those countries where healthcare is provided for those citizens is heavily taxed. They have to tax people in order to provide. And I know everyone doesn't want heavy taxes, but I have recently, because of this message, come to embrace big taxes, because you know, when you're being taxed, that money is being used to take care of someone else. That is if the government is not corrupt. Yes. And some people that are blessed should be using their resources to bless others. And the reason why there's such a disparity between those who have and those who don't have is purely a matter of selfishness. Inequality started in Eden with sexism, and then we proceeded to racism. And those two curses are the mother and father of a discriminated, apartheid-looking, segregated communities all over the world. It may be an issue of race, it may be an issue of gender, it may be an issue of nationalism, it may be an issue of just descent. Nonetheless, in all parts of the world, there is discrimination going on, and we know all of these are curses. And there are always voices trying to rise up against the discriminatory powers, and the NHI is one of the debate around NHI, which is ongoing right now. It's in the news almost every other day. Just read those articles, hear what the people are saying, understand their thinking. And then we need to realize that this argument is not just about who provides healthcare where, but it's about how we view another person. How do we view the next person? Do we view them as an equal, or do we not care? It seems at this point that in the private sector, nobody cares about the vast majority of the population, the 83%, who cannot afford to go to a private doctor or access private services, who their only option is to go to the nearest clinic that is running short of drugs, that is running short of staff, that is so far away from the services. Even what Mom is saying, there are disparities between provinces. Western Cape versus Limpopo, big, big disparities that are unbelievable sometimes to imagine they happen. There are times when we have to tell our patients, do you have a relative in Johannesburg? If you have a relative in Johannesburg, then go to Joburg and then go to the nearest clinic. That is how you will access a quicker service than if you stay in Limpopo. So even within government, there are disparities. And these disparities are God is trying to reverse inequalities. And the world is not really cooperating. We see the Democrats have not cooperated with their mission. And now we see the ANC is not cooperating with their mission because they keep compromising with the big business private sector to make money. And when they make money as a government, are we really seeing it helping people on the ground? Yes, there has been some progress that has been made, but not near what it could be. So anyway, let's take a break. We'll come back and finish this in the afternoon. Thank you everyone for your contribution. Let's close with prayer. Our Father, our God in heaven, we thank you for your love and mercy and for continued guidance and opening our eyes to see so that we can have better discernment. Bless each person that is here and every family that is represented here. We thank you for the Sabbath so that we can rest and commune with one another. Teach us to love one another and teach us to see each other not through the lens of race and gender, but always view the next person as a beloved of God, one that deserves to be treated as we would want to be treated. May you grant us a period of rest until we return. In Christ's name we pray. Amen.